Hi friends, so we are back again and today we're going to go ahead and talk about health insurance or health care in US. And for this topic I've asked my husband, my hubby, to join because he's quite knowledgeable in this field. So let's get started. So as I also have told you in one of my previous videos, that health insurance in the US is really good. So it's one of the top, in the world. But on the other hand, it's also one of the most expensive. So now he's going to take over and tell us more.
So basically, if you look at the health insurances, let us talk about the money, right? Because there are some costlier plans, there are some cheaper plans. So if you go with the costlier plans, what's going to happen is that you can go to any doctor and you pay a copay. Copay would be like, let's say $20. So you give them $20 and you can see a doctor, and that's all you need to pay. And although you will get the bill that will show you the cost that they charge the doctor and how much in discount did the insurance give you, and finally how much did they pay. But it's none of your problem. You just paid the copay and you are done with it. Now these kind of plans are really costly in the sense that many times the employers pay a part of it. I mean, all good employers will pay a part of it. I have not seen any good employer that has not paid anything. So it could range from probably $300 to sometimes $600 per month from your paycheck. And normally this is pre-tax money that is cut. So in this, right, this is the first tier of the money that's involved. Now the other plans are the high deductible plans. And high deductible plans, they say that, hey, you need to pay the first, let's say $3,000 per person. And once you pay that, and there is a family limit of $5,000, then we will start paying to some degree. So for example, if you have a high deductible plan, you go to a doctor, he says he's going to charge for one visit $200. The insurance will say, okay, we'll give you some discount because the doctor is in our network. So it's going to be like $150. So you pay the $150, so that goes in as that you have paid $150 for this year. Then let's assume somebody else in your family is sick, you go again and this time you pay $200 and now you have around $350. So something like that, when it reaches the family maximum, let's say $5,000 in 1 year, then they'll say, okay, now that you have reached $5,000, beyond this, whatever bill comes, we will pay 80% and you pay 20%. And that method will go on from $5,000 to, let's say, $7,500. And even then, if something goes beyond $7,500, then they will say, okay, now we are going to take care of any expenses that you have, right? So these are the only difference is that in high deductible plans, they are a lot cheaper, right? In a month, you'll probably pay from $100 to $200 a month compared to where it was like, $300 or $600 a month. So the premium reduces a lot. Now these are the tiers where you can say, okay, these are the copay plans versus the high deductible plans. But then within these plans, you need to look at what kind of plan it is, right? All insurances have a concept, I mean, not all, but most have a concept of in-network and out-of-network. So in-network means that if the doctor is in their network, they will give more discount, so you will pay less. But if the doctor is not in the network, then they do not have any agreements with this doctor, so the discounts will be less and you will end up paying much more. Some insurances say that, hey, we do not accept any out-of-network doctor.
So actually, I just want to clear here what in-network and out-of-network means. So in-network they have some list of doctors, and those doctors are considered to be in-network. So they recommend you to go to those doctors. Whereas out-of-networks would be those doctors which are not in their list. They are not affiliated with them, or they are not, working with this insurance or insurance company. So that's what in-network and out-network means. So when they say, they prefer you to go to the doctors that they have already had some kind of dealing or, some kind of understanding with them.
Right. So in the US, right, everybody has to have insurance. Like if you are working, your employer will give you insurance, but there are, of course, if you are minimum wage, you may not get. So, but the point is that each doctor is affiliated to a bunch of insurances. So they'll say, hey, I accept these 10 insurances and I'm in network for these. But you are allowed to go out of network. It's just that you have to pay more money. If the doctor does not have any relationship with the insurance, then you are at a disadvantage, because you can go to out of network doctor, but then whatever they are charging, how do you know that's the right price? Maybe they are just inflating and charging much more. So insurance helps you because they say, hey, for each procedure code, this is the ballpark money that we are going to that you can charge your patient. You cannot charge whatever you feel like. Initially, I mean, they will bill what is the rate, but then insurance is going to give a discount and say, this was the negotiated price with you for this procedure code. Now, so that is the one protection that you get. Plus, the other thing is that, you have, going with insurance means that first, you don't have to pay on the spot to the doctor. You say, hey, just bill my insurance, and then whatever they pay, whatever remains, I will pay. So this is a good protection that you don't have to pay on the spot. Now the other point is, right, about the insurances that I was talking about earlier, there is one called HMO and one is a PPO. So the concept with HMO is that they will say, they will say, the insurance said, this is my network of doctors, and you can pick a primary care physician. So anytime you are sick, you go to the primary care physician that you have chosen, and that person will look at you and then decide if you need to see somebody else. So that is the HMO. PPO means that I can choose to go to any doctor in their network. For example, I need to go to a skin specialist. I can directly go to a skin specialist. The skin specialist may see and they may say, hey, okay, this is something that your doctor could have taken care, but they'll say, fine, okay, my bill is going to be $300, so I'm going to bill you $300, and that's fine. But in the other point, right, when you are with the HMO, you go to your primary care physician, he can say, no, you don't have to go to a skin specialist, I'm going to treat you. So that limits your ability to directly see a specialist. So HMOs are not so good in that manner where they restrict who you can see. Okay. Now the other fact that I was saying was that in US, everybody needs to have insurance. If your employer will give you the insurance, but some employers, if you are in daily wages, they will not, and then you have a problem. But essentially, you need to have insurance. So what happens if you do not have insurance? Right? If you don't have insurance and you get sick and you go to a doctor, they'll say, sorry, we can choose to decline coverage because you have no insurance. How are you going to pay? I mean, that is only if the person cannot pay, right? I mean, if they can pay, fine, you pay. But if you cannot pay, then they cannot treat you. But this usually does not apply to emergency. So I don't have insurance. For example, if somebody doesn't have insurance and they have a heart attack, they will call the 911 and then they will send the ambulance. The ambulance will take you to a hospital, and then you say, hey, I don't have insurance. So they will still say, okay, this guy has a heart attack. Let's do something to recover him for now. So they will give you some medication. They will probably check you out. They'll do something so that you are kind of feeling a little better. And then they will say, okay, now you can go. Now you can come home and then you can die the next day, because they basically did nothing. They only made sure that you didn't die at that point. But with insurance, then it will be good that they will take care of you. The other thing is that before you're going on a surgery or something where it's a huge medical bill, what you need to do is you need to get an estimate. So you get an estimate from the doctor or hospital, and they will say, I'm going to charge so and so, and then you give that estimate to the insurance. Sometimes this process works via the insurance. So doctor will submit the estimate to the insurance will look at it, they'll say, okay guys, we will cover this and we will not cover this. So what this means is that insurance does not cover everything. They will cover most of the things, but some things that do not cover. So that is the one thing. Also the insurance, what we were talking about is the medical insurance. right? That does not apply to dental or vision. So if you have issues with teeth, you need to take a dental insurance. If you have issues with the vision, you need to take a vision insurance, and so forth. So these are the key factors.
And they are also very expensive.
Yeah, and the dental works on a different methodology. What they say is that we will only pay you up to, for example, 1,500 in a year, right? So this is not like if you have a major issue, they'll pay like as much that it takes to get you fixed. No, they will max out at, let's say, 1,500. That's it. And many things they will not cover in dental. They'll say, hey, this kind of filling we don't cover. So, you know, I can give you the alternate filling of so and so. So eventually dental coverages seem to be pretty thin in the sense that they cover very little.
Guys, he's wasted, I mean, I don't know how many thousands and thousands of dollars in his teeth, you know, dental stuff. So it's really expensive. And generally I've heard that people, you know, when they have dental problems, especially Indians, they avoid doing it here and they go to India to get this done. Even, you know, doctors here, I know doctors who've gone, instead of, you know, getting their dental things done here, they go to India and they get it done there. So that's quite amazing. Right. Just because it's expensive, right. Not because it's better there.
Yeah, I mean, the only point is that the quality of work is pretty good, right? Yeah. It's really good.
In
US. And then there's a concept of ER, which is emergency, and the concept of after hours urgent care, right? So normally the doctors will only be available in their offices like 6 o'clock. But what if your son is sick at 7 o'clock? Then what do you do? So you have two options. You can first go to the urgent care. The urgent care centers, they are like open usually till 8 p.m. So from 8 in the morning to 8 in the evening, they are available. You can go there. They will charge higher money, but some doctor will take a look at you, right? The other, what if it happens at 10 o'clock? Then the urgent care centers most likely will be closed. Most closed by 9, 10, but after 10, you will usually not find any urgent care centers. Then you go to a ER, emergency. When you go to the emergency, they are going to bill very solid. You could end up paying, I mean, you could end up with a bill of like $3,000.
Right?
Yeah, $300 for one night. And they will treat you like you are in a hotel, right? Everything is fantastic and they will take care of you. They'll give you this and that. But the bill is $3,000 for one night. Now, obviously, insurance is going to pay some part of it based on what kind of insurance do you have. If you're high deductible, then you had a limit of 5,000. So if you have not reached that, all the 3,000 goes from your pocket, and then and that's it. And then you wait for the 5,000 limit, and then they will start paying. But the good point is that you always go to an emergency or an urgent care that is in your network, because then they may bill anything to you. The insurance will apply the discount. So always remember that insurance is going to discount it. They'll say you are in my network and for this procedure code, this is the negotiated price. And that way you get some savings. If somebody else goes in and he has no insurance, then they can charge him anything. And legally you have accepted their care, you'll have to pay for it. So I think these are the basic things to remember. Like in some countries, for example, Canada or something, I heard that you have long lines when you go to see a doctor, and then it takes you, there's a waiting list. But in US,
even in India,
I mean, over here, that concept is not there because it's pretty good coverage. You go and in an ER, you normally waiting time is probably 2-3 minutes or and not more than that. And urgent care, I've seen up to like 10 minutes. And there's no such waiting and you can get it done. But of course, everything is based on money. So they bill you huge and you need to have insurance, and insurance is costly. The employer will cover some part of it depending upon what employer does. Each employer is different. But in the end, healthcare is important. Now, when the premium depends upon either only you. There's one tier that only one person wants to be in the medical plan. The other could be you and spouse. That is another rate. Then you can have 1 plus children, or you can have 1 and the family. So as the group grows, the premiums increase. But in a family, it does not matter whether you have 1 child or 10 children. It's the same cost for a family.
Which is good.
Yeah.
For bigger families.
Bigger families. Yeah. So that is how those tiers are in insurances, right? And I think these are the basic things. And then when you lose your job, you have some period like 90 days in which your old insurance will apply. So when you lose job, the first thing that people are scared about is what's going to happen to my insurance. So normally you have like COBRA, which is an acronym, but eventually, what that means is that you have like 90 days, you can use their insurance, but you have to pay for it. So maybe the discounts will end. So you leave a job, the discounts will end, you'll have to pay the whole thing for 90 days if you do not have another offer. But if you join the other company, then of course they will give you the insurance and so forth. So these are some of the things that you need to care about.
So guys, we'll end our talk now here, and we hope you found it informative and it will help you if you're planning to move to US, and if you're not, it's just giving you a general idea of how the medical system in US works. So we'll take your leave and we'll come back again with another video pretty soon. Till then, take care. Bye-bye. Guys, I also wanted to share with you a good news. The good news is that for those who like to watch Hindi videos, I've got another channel and I've started it, and its name is Momzilla, MOMZILLA, MOMZILLA. So do check that channel out too. It's going to be a Hindi channel, and in that channel I'll be talking in Hindi. So see you. Bye-bye. Take care.
And if you're new to my channel, don't forget to hit that subscribe button and hit the bell icon so it notifies you when I put in my new video for you to enjoy. Bye.